Hi, good afternoon, Congressman Gooden and staff. My name is Valerie Mack. I'm a licensed baccalaureate social worker in the state of Texas and have been for 17 years. In that time, I've worked for Parkland Health in the community-oriented primary care clinics, primarily serving the pediatric population. I also happen to be a constituent in District 5 and a registered Republican in the state of Texas. I appreciate your time today to hear about an important issue that impacts both our local and national communities. I have become aware of HR 5815, a bill to expand and improve the Head Start program, and I'm compelled to inform you of my support of this bill. In 2021, the national child poverty rate was 16.9%. In Dallas County, where I reside, it was 21.2%. These concerning rates of poverty amongst children who are our future spurred me to think of what types of interventions could help reduce these rates. My first thought was education. See, although I was raised in Texas, a small middle income family comprised of two working professionals, both of my parents were raised in very poor households in Puerto Rico. Despite their poor upbringing, the one factor that made all the difference was education. My grandparents were able to enroll my parents in school at a young age and encourage them to continue their education through to higher education. I'm proud to say that both of my parents were able to obtain not only their undergraduate, but also graduate degrees, something that I'm in the process of doing myself at this time. The patient population that I work with on a daily basis is comprised of children from low-income families, most of whom have Medicaid and many of whom receive SNAP benefits. These are the same families that will be helped by the bill, which is going to expand coverage for families receiving public assistance benefits. It is also going to expand the income criteria to allow more lower income families to qualify for Head Start. I have seen tremendous differences between children who have had access to early education and those who have not been able to access early education. Those who have been able to access early education have continued down a path of valuing education. And I've been fortunate to see many of those young children graduate from high school and go on to pursue higher education, something that I know will help them throughout the rest of their lifespan. I've seen the benefits for parents who themselves have been inspired to further their education and for whom having appropriate childcare has allowed them to work full time, which has improved their overall socioeconomic status. I also see the extreme value of the developmental assessments conducted through Early Head Start and Head Start that help to identify children in need of early intervention services. It is well known that early intervention services help reduce the amount of disabilities in children. HR 5815 would increase the overall amount of funding for Head Start programs and more specifically would provide grants for revitalization of Head Start sites in need. The bill would also allow for student loan forgiveness for Head Start workers and an increase in pay for the workers. This would allow Head Start to recruit and maintain highly qualified staff to serve this population in need. I know it's difficult to choose to spend any amount of money, especially when resources are limited, but I sincerely believe that an investment in early education is the best use of our limited resources, as it will help to lift countless generations out of poverty and will ultimately save the taxpayers' money. I sincerely urge you to support HR 5815 to expand and improve the Head Start program and to encourage your fellow congressmen to vote in support of the bill. If there's any further evidence that I can provide to aid in your support of this bill, I would be glad to provide any information necessary. Again, thank you for your time today to hear about how you can support our future generations to be lifted out of poverty so they can become self-sufficient. Thank you.